Hello, this is Father Bruce Wilson at the Center of Hope. That's the name of the shelter, the homeless shelter at the Salvation Army. And this is the 6th video of people experiencing homelessness, voice of people experiencing homelessness in Corpus Christi. And the name of this video is What Can Be Done? If you want to help us resolve our trauma, the first step is to help us find a safe place. Our symptoms of trauma are that we continue to feel unsafe, physically, emotionally, and relationally. That's why our trust is so low. Even our trust in well-intentioned people who promise to help us, but don't always know how. As long as we're on the streets, it will be almost impossible to get off the streets. All the requirements for getting off the streets: an official photo ID, a social security card, birth certificate, voter's registration, food stamps, a county clinic card, prescription medications, the living conditions needed to follow a medical regimen as prescribed, an address to give to a potential employer, a job. All of these things are almost impossible to secure for people while they're still living on the streets, while they're being threatened, beat up, robbed, or stabbed. Housing is not the end game. Housing is just the beginning of putting our lives back together. Trauma-informed case management will be imperative for most of us who take the journey from our dysfunctional family on the streets to a healthy community with new friends and neighbors. What kind of housing works best? Tiny home village, apartment with roommates, sober living home, individual efficiency apartment. Ask us. Don't just ask a few of us about the rest of us. Remember that we're all diverse, just like you. What works for one of us doesn't necessarily work for another of us. Each one of us needs to be on the spreadsheet, known by name, engaged personally, and tracked individually on our progress. That's exactly why the Ending Homeless movement is so successful across the country. If we have voice, we have ownership. Ask us individually what will work for us. Just help us find a safe place where we can be successfully putting our lives back together again. Safety first is what heals people who were traumatized by an event or by ongoing conditions, usually in childhood, which threatened their survival, at least in their emotional brain. Empowerment, second, is the next step to recovery and healing, helping us to accomplish the requirements for getting a job and learning to live independently, helping us learn all the social, financial, and life skills to be successful, helping us change people, places, and things, encouraging us to find our inner strength by asking us resiliency questions like, what's right about you? What are your strengths? What is your plan? How can I support you? Take time to just accompany us, to just walk beside us, to listen to us. Give us time to learn to trust you. You never know how or when we will be triggered again by a something, an anything, a nothing. It might even just be a smell or a sound or a gesture or a look on your face. Learning to trust you is a process. Learning to trust life is a process. Please keep coming back. Don't give up on us. If you listen to us before you try to help us, if you include us and involve us, if you take things one step at a time, we will have ownership in the process of change. Talking about us without us is the best way to lose us. Don't act like you know what's best for us from your ivory tower. Get to know us. Walk a mile in our shoes. Hear our stories. See our inner hearts. Don't just judge us by our outward behavior. Don't act like we're invisible or stupid. Get to know us. At least see us. Here's something that might help. It builds on a simple but powerful prayer based on the Zulu word "Sawubona," which means I see you. It's a prayer some of us use in our meetings of the peer advocate team of the helping homeless community. We go around the circle. The first person says to the next person, I see you. The next person says, I am here. I see you. The first person says, I see you. And we go around the circle and we see each other. We're so often invisible. Please, see us. Not just on the outside, but on the inside. Make a decision about what to see in us and how to see us. Remember, you have a choice. Here's a little tip and a poem about how you can choose what you want to see in us. The tip, we're complex. Just like you are. We all have a self that is a mask that we present to others. It can be self-sufficient or tough or angry or complacent. While on the inside is a self that is scared, vulnerable, and worried, and needy. We're not one thing or another, just like real people. Here is a poem that captures two different ways you can choose to see us. One way leads to judgment and shaming. The other to love and compassion. One way pushes us further away. The other draws us closer to you. One way is life-giving. The other way leads to death and destruction. The name of the poem is You See, I See. You see heroin. I see low self-esteem. You see cocaine. I see fear. You see alcohol. I see social anxiety. You see track marks. I see depression. You see a junkie. I see someone's son. You see a prostitute. I see someone's daughter caught in addiction. You see self-centeredness. I see the disease. You see a pillhead. I see overprescribing of opiates. You see someone unwilling to change. I see someone who hasn't connected with them yet. You see denial. I see someone hurting. You see someone nodding out. I see God showing us they need help. You see the end. I see the beginning. You see a dope fiend. I see a future success story. You see them. I see me. The next video is a discussion with Kyle Knudsen, the director of the Center for Hope at the Salvation Army. We're going to talk about this topic. So one more video to go, a bonus video, the interview with Kyle. I'll see you there.